University of Maryland Capital Region Medical Center is the only trauma center in Prince George's County. We're a level 2 trauma center, which means we can take care of almost any patient that's traumatically injured. At any time, you want to know that you have a safe zone, that you can be brought to a place where you're going to be cared for, where your potentially life-threatening injury is going to be managed, and to try to pull you out of that acute situation. So we're, I would say, the safety net service, and we enjoy that responsibility. Traumatic injury is very variable. It's anything from just tripping and falling and having a head injury or a spine injury, or unfortunate events where there's violence and gunshot wounds, stab wounds that can really take a toll on patients and their families. Motor vehicle crashes, falls from ladders, really anything where someone can have a serious injury where they have the potential to need surgical intervention or critical support to save their life. Most hospitals have an emergency room, or at least some emergency services. A trauma center is a specialty center that has lots of other resources to care for the most injured patients. We have an incredible team of not only trauma dedicated providers, but really lots of places throughout the hospital that join together to support patients. Trauma can't be done by a few people. It's really a kind of service and need that spreads throughout the hospital, where we touch on almost every resource that the hospital has to provide in order to care for these patients. My goal is for patients to leave the hospital knowing that they've received the best care we can possibly give, and that they're starting on the road to recovery, because the road to recovery after trauma is much longer than the hospital stay. And we try to reassure patients and support them through that transition, and having them satisfied that they are getting out of the hospital on the right foot and going down that road to recovery.